Hello student, welcome you all again to this Unacademy platform. I hope I am audible and visible also. Okay, I'll just wait for a few seconds. Okay, so as per the plan, we are going to discuss one important topic from cardiovascular system, that is the pressure volume loop in cardiovascular system, right? Myself, Dr. Soumen Manna. I have done my MD Physiology from All India Institute of Medical Sciences, New Delhi. Now you can join my courses in Unacademy Learner platform by using my referral code DRSOUMEN10, right? So I am taking there on a regular basis course on nerve muscle physiology and CVS physiology, right? And in the next month we are going to discuss some other topic in the cardiovascular system, right? So in pressure volume loop, what we are going to discuss, we'll take some help of some MCQs, but before going into MCQs, we'll understand what is basically pressure volume loop, right? Now to understand pressure volume loop, all of you know that you have to have an idea of cardiac cycle. At least the different phases of cardiac cycle, you have to have an idea. Okay, so first of all, I'll quickly go through the different phases of cardiac cycle with the help of a diagram, right? So this is the different phases of cardiac cycle given in this diagram. So what is this cycle? This cycle indicate that this is nothing but total duration of the cardiac cycle. Total duration of the cardiac cycle is 0.8. So within this 0.8 second duration, whatever is happening inside the ventricle, that is nothing but the cardiac cycle. Okay, so these are the different ventricular event, okay, or ventricular phases, which is nothing but cardiac cycle. Now if you start from here, okay, that is the beginning point of the diastole. Okay, now please remember, at the beginning point of the diastole there is closure of the semilunar valves. Now whenever there is semilunar valves are closed, already the tricuspid valve was closed and bicuspid valve was also closed, so the phase that will start after the closure of this semilunar valve, so in this direction the cycle is moving. This phase is known as the isovolumic relaxation. Very, very important phase to remember, because at the beginning of this isovolumic relaxation phase there is closure of the semilunar valves. So my answer is that second heart sound occurs at the beginning of this isovolumic relaxation phase, right? Now at the end of the isovolumic relaxation phase, okay, where the ventricle is relaxing, the ventricular pressure will be very, very low at this point, okay, and in this point the atrium pressure will be more than ventricle. So at the end of this isovolumic relaxation phase, ventricular pressure is almost zero and atrium pressure is more than ventricular pressure. That will leads to opening of the AV valves. Now whenever the opening of the AV valves are there, we all know that what will happen, the ventricular filling will occur like this. Now first filling of ventricle is very, very rapid, that's why the name of the phase is the first rapid filling phase, followed by there is a slow filling phase in the ventricle, which is also known as the diastasis. So this is a slow phase, this is a rapid phase of ventricular filling, right? Combination of these two phases is known as the passive filling of ventricle, which is responsible for altogether total 70% of ventricular filling. Now even after these two phases, some amount of blood is still remain in the atrium, which is pumped by or which is pushed by atrial contraction. So again there will be a rapid filling within the ventricle, which is known as the last rapid filling phase, which coincides with the atrial systole. So atrial systole has a duration of 0.1 second. That's why this last filling phase, which is rapid in nature, this also has a duration of 0.1 second, right? So combination of these three phases, first rapid filling phase, slow filling phase, and last rapid filling phase, the total filling of ventricle will occur. So I can easily understand at the end of this last rapid filling phase, the volume of blood which is present in the ventricle is known as the end diastolic volume, right? And this last rapid filling phase is occurring due to atrium contraction, which is active contraction. That's why the name of the filling phase is active filling phase of ventricle, which contribute to 30% of ventricular filling, right? Now when the ventricle is filled with end diastolic volume, it starts its systole. So this is the onset of systole at this point. So whenever there is onset of systole, the immediate event is closure of the AV valves. So why I should remember this? Because this is the point where the first heart sound will occur. So there will be a question that first heart sound occur at which point? Your answer will be occurs at the beginning of the isovolumic contraction phase, right? So during this isovolumic contraction phase, ventricle is contracting, and whenever it overcomes the aortic pressure, there will be opening of the semilunar valves. Okay, so at this point it is overcoming the aortic pressure, and whenever the opening of a semilunar valves occurs, obvious thing is that there will be ejection. First is rapid ejection, followed by slow ejection. Okay, now when the ejection is complete at this point, the amount of blood which is remaining in the ventricle is known as the end systolic volume, right? Now between this end of ejection and beginning of diastole, so this is the ending point of ejection and this is the beginning of diastole, there is a small duration phase which is known as the protodiastole phase. Basically during the protodiastole phase, the ventricular muscle is relaxing, but the chamber has not started its relaxation yet. That means chamber volume has not been increased yet, but the muscle is relaxed at the molecular level. Calcium is mopping up and muscle is relaxed. So this duration is very short, that is 0.04 duration. Some of the books are not taking consideration of this phase, so you may forget, but protodiastole basically according to Genong, it's a part of diastole phase, right? So this cardiac cycle figure that I have given here, you have to remember these different phases, right? Now after these different phases, now coming to what is PV loop, right? So in the previous diagram I have shown you different phases only according to their sequence. Now if I want to record or plot the pressure changes within the ventricle along with the volume changes within the ventricle, then it will form a loop. That loop is known as the pressure volume loop. The diagram is given here, it is taken from Guyton, but how this diagram is plotted, now look at. First I will show you how this diagram is plotted. So y-axis, I told you this is the pressure axis and x-axis is the volume axis, right? So first of all I am plotting one single line like this. So I am saying this line, maybe suppose I am giving A and B. This line I am saying this is the filling phase of ventricle. This is the filling phase of ventricles. Now whenever I am saying filling phase of ventricle, just now we have seen that ventricular filling means it has three different phases of filling. First rapid filling phase, followed by slow filling phase, and followed by last rapid filling phase. So all this filling of ventricle is occurring within these phases, right? Now look at what is the meaning of this line. What is the meaning of this line to you? The line meaning is that whenever the volume within the ventricle is increasing in this direction, the pressure rise within the ventricle is not that much significant. Volume rise is high, but pressure rise is not that much. Question is why? Because of relaxation of the ventricle. More and more blood is coming to the ventricle. Ventricle is relaxing proportionally. That's why, because of the stretching of this ventricle, the ventricular pressure is not rising significantly. But note down, suppose the person is suffering from fibrosis of the ventricle. So what happens whenever there is fibrosis of the ventricle? We know there is decreased compliance of ventricle. Decreased compliance means ventricle stretchability is not that much. Now if the ventricular stretchability is less, what will happen to this A to B line? Simple answer, this A to B line will be shifted in the upward direction. What is the interpretation of that? Means for the same volume of blood, ventricular pressure is more than normal pressure. Why so? Because ventricle is not able to stretch properly. Ventricle is not able to stretch properly. That's why the same volume of blood is giving much pressure within the ventricle. That is the meaning. So if the line is shifting upward, that means the compliance of the ventricle is less due to any reason, right? Now next, now I'm deleting this line. Okay, I'm just deleting this line. Okay, suppose the green line is not there. Green line is not there, right? Okay, so normal ventricle. Now what will happen? When the ventricular filling is complete, just now I told you that when the ventricular filling is complete, the volume of blood which is present in the ventricle is end diastolic volume. So B point is the end diastolic volume. Now I am plotting another line on this curve. This line is a almost straight line which indicate this is the pressure at the level of arch of aorta. We all know arch of aorta pressure is nothing but the afterload. So suppose this is around 80 millimeter of mercury. So we know aortic diastolic pressure is 80 millimeter of mercury. It will increase, but on an average, suppose this is the 80 millimeter of mercury. Okay. Now, when the ventricle is filled with end diastolic volume, which phase of cardiac cycle will start? That we have just discussed. Now the ventricle will start its systole. Whenever it starts its systole, the first phase is isovolumic contraction. So what do you mean by that? Isovolumic means the volume will remain same, but the pressure within the ventricle is rising. Now whenever this ventricular pressure is more than aortic pressure, so this green color line is the aortic pressure. So whenever this ventricular pressure is more than this aortic pressure, what happens? We all know there will be ejection. Ejection means, look at this red color line. What do you mean by this red color line? This indicate that the line is shifting on the left direction. Left direction means what is happening to the volume? Volume is decreasing. Along with that, what is happening to the pressure? Pressure is rising. So volume decrease, pressure rise, going on. During the slow ejection phase, the volume is decreasing. Along with that, pressure is also decreasing. So basically, after the opening of the semilunar valve here, the ejection is occurring. During the rapid ejection phase, volume is decreasing but the pressure is rising within the ventricle. Then both volume and pressure is decreasing. So this kind of change of volume and pressure simultaneously, this is known as oxytonic type of contraction. Oxytonic, not isotonic, not isometric. This is oxytonic. What do you mean by that? When volume and pressure both are changing simultaneously, that type of contraction is oxytonic contraction. Now at the end of this contraction, see here, now the red color line, yes, now the red color line is going below the green color line, indicating ventricular pressure is going below or lower than aortic pressure. Imagine when the ventricular pressure is lower than aortic pressure, obvious thing is that the blood from the arch of aorta will try to come back, but that will be prevented by closure of the semilunar valves. So that's why this is the point where there is semilunar valves closure occur, right? Now whenever the semilunar valves are closed, we all know that the next phase is ventricular relaxation with all valves closed. That is the isovolumic relaxation. So volume is remaining same, but the pressure is decreasing. So again we are ending at this point. This point is known as the end systolic volume. Okay, obvious thing, this is the point of second heart sound. Great. So this is the point of second heart sound. Now when we are reaching at the end systolic volume and the ventricular isovolumic relaxation is complete, then what will happen? This is the point where mitral valves will open up. So whenever there is opening of the mitral valves, we know there will be starting of ventricular filling again, and we are reaching at the end of ventricular filling. So ventricle will start contraction. Whenever ventricle start contraction, there will be closure of the mitral valves or atrioventricular valves, right? So this is the point where the first heart sound will occur. Am I clear? So this brief description of the PV loop is given in Guyton with this diagram. Okay, so quickly, if you go through this diagram, so what you're finding out here, this is 50 ml. So this is nothing but end systolic volume. This is 110 and more than 110, so maybe this is 120 ml. So this is the end diastolic volume, right? So from this A to B, this phase is known as the ventricular filling phase, right? Then from this B to C, this phase is nothing but the isovolumic contraction phase. Then from this C to D, this is the period of ejection. This is the period of ejection. And from this D to again A, this is the isovolumic relaxation phase of ventricle. So it is making a loop. Because of this loop, the loop is known as the pressure volume loop. Because of the shape of this loop, it is known as the PV loop in the cardiac cycle. Okay, so now I will put some MCQs and pressure volume loop abnormalities also. So you try to answer. So whenever you get the answer, just type the answer in the chat box. So I will see and then we will discuss. So first MCQ, this is the MCQ in front of you. Try to answer. Right. So you have discussed everything. All of you try to answer A, B, C or D. What is your answer? Right. Anyone? Okay. So if I ask you that you have to calculate the cardiac output. Right, cardiac output, yes, very good, the correct answer is coming. So cardiac output means I require stroke volume, I require heart rate. This is our formula. So heart rate is given here already. This is 70 beat per minute. Heart rate is given. So what I require to find out the stroke volume from this PV loop curve. Okay, so stroke volume, how to get that? I told you that this is the ending point of systole. Okay, this is the ending point of systole. Same amount of blood is also present at the point number A. So whether, listen carefully, whether this is point number A, D or point number A, the volume is same to same. The volume is same to same. That's why this is isovolumic relaxation phase. But at the end of this isovolumic relaxation or at the beginning of this isovolumic relaxation, whatever blood present in the ventricle is nothing but end systolic volume, right? Then the ventricular filling is going on. At the end of ventricular filling, the volume of blood at point number B. So if I drop a perpendicular from here, that is cutting 150 ml. So this 150 ml blood is the volume at the end of diastole. This is EDV, end diastolic volume. So whether you take this B or point C, the volume is same. Okay, so end diastolic volume, and we know EDV minus ESV, that is nothing but our stroke volume. So basically here the stroke volume is 150 minus 50. So this is basically 100 ml is the stroke volume. Okay, so that's why in the previous diagram you have seen the one line is given like this and it is written this is nothing but the stroke volume. Okay, so basically during this ejection phase the volume of blood which is going out of the ventricle, that is equal to the volume of stroke volume, right? Okay, so obvious thing is that stroke volume is 100 ml and heart rate is 70, so 7 liter is the answer. So this is my answer in this question, correct? Okay, so simple question. Be ready for this type of question not only in AIIMS entrance examination but also in NEET exam. Okay, now again the same PV loop I have given, but here I have asked you to calculate the ejection fraction. Quick answer I require. Same curve. So same curve means this is the same. So ejection fraction, we know this is equal to stroke volume upon end diastolic volume multiplied by 100, because it is taken as a percentage. So stroke volume we have calculated already, 100 upon 150 is the end diastolic volume multiplied by 100. Okay, so this is how much? This is, so sorry, stroke volume is how much? I'm sorry. Stroke volume is 100 upon 150. Okay, so 100 upon 150 multiplied by 100. So this is yeah, 200 upon 3. So how much? 66.7%. So I'll go for this one, right? 67%. Very simple. So you just have to put the stroke volume. Stroke volume we have already calculated, that's the 100 ml, and end diastolic volume is 150 ml multiplied by 100. So this is nothing but the 66. Okay, right, D. Correct. Okay, so they will see you are correct. So you have to just take some time, nothing but. Okay, very good, 67%. Okay, very good, 67%. Right, now the next MCQ. When does the second heart sound occur in the ventricular pressure volume relationship? Already we have discussed, so try to answer. Okay, second heart sound they are asking. So which point? Any answer? So I'm waiting. So I told you that this point number A. Yes, very good. So this is the point which is the second heart sound, and this is the point which is the first heart sound. Okay, so point D. Very good. So this is the second heart sound and this is the first heart sound. Now could you answer that if I ask you that third heart sound or fourth heart sound, what is the answer among this? Try. So here the answer is D, point number D, that is the answer A, right? Okay, Dr. Bhanu Pratap, you are also correct. Okay, point number D. So point number D or option A, whatever, that is your correct answer. We have discussed. Now I am asking third and fourth heart sound. Option are same. What is your answer? Third and fourth heart sound, A, B, C, D, which will be the answer in that cases? Yes, between A and B is 3. Option D. Excellent. So third heart sound we know that is due to first rapid filling phase, and fourth heart sound this is due to last rapid filling phase, which is nothing but the atrium contraction, So basically both third and fourth heart sound is occurring due to which phase of cardiac cycle? Filling phase of cardiac cycle. And filling phase of cardiac cycle means here this is nothing but A to B. This line is indicated by filling phase. So if I have to pinpoint, then on the first half of this filling phase will be the third heart sound, on the later phase of this filling phase will be the fourth heart sound. So this is the fourth heart sound point, this is the third heart sound point. Okay, so this is the additional point that you have to remember from here. Next question I am going. Okay, so this question already been asked in NEET exam. At which point ventricular pressure is close to diastolic blood pressure? Ventricular pressure is close to diastolic blood pressure. Okay, what is your answer? Guess or give the correct answer. Anyone? Option A you are talking about. Option A, yes. So point number C. Any other? So point number C you are talking about. Very good. So A option is the correct option. Point number C. Why point number C? Because this is the point where there is opening of semilunar valves. Opening of semilunar valves, right? Opening of semilunar valves means, okay, no, it's not the option D. Okay, so just remember this C point is the opening of semilunar valves. Now what is the concept of opening of semilunar valves? See here, suppose this is the arch of aorta and this is the left ventricle, right? Now when the left ventricle is contracting, right, when the semilunar valve is closed, left ventricle is contracting and tricuspid valve is also closed. We know this is nothing but isovolumic contraction phase. So isovolumic contraction phase, ventricle is contracting more and more. So what will happen to the pressure within the ventricle? It will increases. Now what is the target of this increase in pressure? The ultimate target of this increment of pressure is to open the semilunar valves. Now I ask you, to open these semilunar valves, how much pressure the ventricle has to generate? Now think, when the ventricle is contracting isovolumetrically, semilunar valve is closed, so the pressure during this time when the semilunar valve is closed, the pressure within the arch of aorta is which pressure? This is the diastolic blood pressure. It is not the systolic blood pressure. Okay, diastolic blood pressure, the minimum amount of blood pressure which is present in the aorta during when the semilunar valves are closed is the diastolic blood pressure. That means if I have to just open these semilunar valves, I have to overcome this diastolic blood pressure in the aorta. Whenever the ventricular pressure is just greater than this diastolic pressure of the aorta, the semilunar valve will just open up. That's why it is said, left ventricular pressure greater than 80 millimeter of mercury, the semilunar valve will open up on the left side, but right ventricular pressure greater than 10 millimeter of mercury, the pulmonary valve will open up on the right side. Okay, because the right ventricular pulmonary artery pressure is 10 during diastole and 25 during systole. That's why right ventricular pressure require only 10 millimeter of mercury to just open the semilunar valves. Okay, so that's why our answer here is the point number C, where the aortic valves just open up. Okay, so this is point number C. This is the question, right? Now next question I'm going. This is a little tricky one, okay, but if you know the concept you will be able to answer. So left ventricular pressure volume is given below, black color line. So this black color curve that you are seeing here, this is the normal curve. Okay, which curve indicate response to sympathetic stimulation, right? Okay, tell me which curve indicate response to sympathetic, A, B or C, or same as normal? So okay, so B. So just let's try to understand. So if this is my curve, okay, so suppose this red color is the normal curve, right? A little defective diagram, but whatever. Now whenever the sympathetic system is stimulated, what will happen to the ventricular contractility? Increase in ventricular contractility. Whenever there is increase in ventricular contractility, look at this, this ejection will continue for some more time. Because of this more continuation of the ejection, what will happen to the stroke volume? Look at, stroke volume increases, that we know, stroke volume increases. So the ejection is continuing for some long duration. Because of that, stroke volume increases and the curve will look like this. So if I ask you, in this new curve, the end systolic volume is normal or less than or more than normal? Your answer will be this is less than normal. Normally end systolic volume was here. This was the normal end systolic volume. Now because of the increased contractility, what is happening? The stroke volume increases. Ejection is continuing for some long time. Because of the long continuation of the ejection, the end systolic volume decreases. So this kind of shifting of the curve is known as left shifting of pressure volume loop. Left shifting of the pressure volume loop. So now if you look back at the same question again, left shifting, so this is the black color curve, this is the normal curve, right? Which curve is shifting on this left? This is shifting on this left. So answer is curve number A, or stress A. This is nothing but here, right? So this is A. Now what about this B and C? You must be confused that what about B and C? So look at the original curve where from I have taken this. Okay, so this was the curve number A in your question. So this is increased contractility due to any causes, maybe sympathetic, maybe digoxin, whatever. Increased contractility means stroke volume will increase, ejection fraction will increase, end systolic volume decreases. So this is nothing but left shifting of the curve here. Okay, now this curve which is moving upward, this is increase after load. Example, suppose the person is suffering from hypertension. Okay, I told you initially that if this is the pressure volume curve, like this, okay, then there is a line here. This line indicates this is the after load line, which is aortic pressure. So if this line is shifting upward like this, then what will happen to the new curve? The new curve will start ejection from here, okay, and it will end ejection here. So this red color curve is the new curve when the afterload is high. In which condition afterload will be high? If the aortic pressure is high, or if the ventricle require more pressure to open the semilunar valves, like aortic stenosis. So aortic stenosis and hypertension, these are the two examples of increased afterload. If there is increased afterload, obviously the stroke volume decreases, end systolic volume increases. So look at here, this is the new end systolic volume which is increased because the stroke volume is less, ventricle is not able to pump, so end systolic volume increases. So this is known as upward shifting of the curve. So please remember, okay, afterload means increase, afterload means upward shift. And if there is increase preload, we all know preload means that is nothing but end diastolic volume. So simple, if there is increase in end diastolic volume, this is the new end diastolic volume here. So this is the new end diastolic volume in this green color curve. So if there is increase in end diastolic volume or preload, then the curve will be shifting in this direction. This is known as the right shift of the PV loop, right? Please remember. So increased contractility means left shifting of the curve, increased afterload means upward shifting of the curve, increased preload means right shifting of the curve. This is the bottom line of understanding different pathology of this PV loop. Why? Now I am giving one question to answer. Okay, so look at this question and try to answer quickly. Okay, the pressure volume loop is shifted to the left in. Okay, left in. So I am telling you the answer because the time is less. So answer is mitral stenosis, right? Okay, so now look at different pathology here. Now first of all, look at these two things, aortic regurgitation and mitral regurgitation. Whenever there is regurgitation, whether it is mitral or aortic, we all know EDV will be more. Okay, now in case of aortic regurgitation, all of you know that the blood is going from the ventricle, then during diastole, some of the blood is again returning to the ventricle. So whenever some blood is again returning from the arch of aorta to the ventricle, and the normal blood is also coming from the left atrium, so blood is coming from left atrium, plus some of the blood is returning from arch of aorta. Obviously end diastolic volume will be high. Now if there is end diastolic volume is high, in the next phase the stroke volume will also be higher. If the stroke volume is higher in the next phase, so what will happen to the aortic pressure? Aortic pressure will be higher. That's why aortic regurgitation also have high systolic blood pressure. Okay, because of this high systolic blood pressure, the afterload is high. If the afterload is high, then the curve will also shift little upward, and obviously it will shift on the right side because of this high end diastolic volume. So please remember, the curve is mainly shifting on the right but slightly upward also because of increase after load, which is due to increased systolic blood pressure. But mitral regurgitation, aortic pressure will not rises. Why? Because whenever the ventricle will contract, the blood will regurgitate back in the atrium. Okay, so that's why simply there will be increase in end diastolic volume and the curve will shift on the right side only. Upward shift is not there. So diastolic blood pressure define afterload. So diastolic blood pressure defines afterload. No. Afterload is mean aortic pressure. Systolic and diastolic both. Okay. Afterload is the mean aortic pressure. Okay. Whether systolic blood pressure increase or diastolic blood pressure, mean blood pressure will increase. So afterload in any cases it will going to increase, right? Okay. Now in case of aortic stenosis or mitral stenosis, see, aortic stenosis, I just discussed that there is increase in afterload. So afterload means which kind of shift will occur? Simple, there will be upward shift. Okay, so the curve become narrow, the pressure volume group become narrow and upward shift. And if there is mitral stenosis, what will happen to the end diastolic volume? Simple, mitral stenosis mean end diastolic volume is very less. That's why this was the original end diastolic volume. Now this end diastolic volume has shifted here. This is the new end diastolic volume. So end diastolic volume decreases and end systolic volume also decreases a little bit here. This is the end systolic volume. So because of this decrease in end diastolic volume and end systolic volume, which kind of shifting is occurring in this curve? This is basically left shifting of this curve, left shifting of this curve, right? So that's why the answer of this question, the left shifting of this curve here, the pressure volume curve is shifted on the left is mitral stenosis. Now last MCQ for today. Which of the following PV loop is seen in? Sir, MAP mainly depends on diastolic blood pressure and diastolic blood pressure is decrease and systolic blood pressure increase. Yes. But here the systolic blood pressure increases much more. Okay, although diastolic blood pressure will fall. I know 2/3 is diastole, 1/3 of systole, but because of the increase in systolic blood pressure, the mean arterial pressure will remain higher and afterload will remain higher. Always the ventricle has to pump with more pressure. Okay. Now look at this curve. Which of the following PV loop is seen in restrictive cardiomyopathy? Okay, restrictive cardiomyopathy. Initially at the discussion I told you that if there is a restriction in the ventricle in the form of fibrosis or scarring, then the curve generally shifts upward. Okay, so you look at all this curve, the curve where the curve is shifting upward mainly. Okay, that is the B stressing here, that indicate the restrictive cardiomyopathy. Now just remember like this. So there are three different types of cardiomyopathy. Dilated cardiomyopathy, all of you know that there is enlargement, ventricular enlargement with impaired systolic function. So what will happen? Dilated cardiomyopathy means I have to remember this: EDV increases and contractility decreases. EDV increases, contractility decreases. So what will happen? This is the typical curve C. This is the typical curve where EDV is very high, and because the ventricle is in a failure state, it has completely shifted from the normal curve like there. Okay, so this C is the dilated cardiomyopathy. Second, hypertrophic cardiomyopathy. disproportionate left ventricular hypertrophy. So because of this ventricular hypertrophy, see here what is happening to the end diastolic volume. End diastolic volume decreases, okay, and what is happening to the contractility? Contractility increases. So hypertrophic cardiomyopathy means end diastolic volume decrease and contractility increases. So see here, so contractility increase means I told you the curve will shift in which direction? Left direction. So the curve is shifting here. So this is the curve where the contractility is high and end diastolic volume decreases. Look at this point. End diastolic volume decreases. So this curve A is the hypertrophic cardiomyopathy, right? And restrictive cardiomyopathy, endomyocardial scarring, myocardial infiltration. Because of this scarring or infiltration, EDV decreases, contractility decreases, everything decreases, okay? So EDV decreases, contractility decreases, and I told you the curve become more steeper. So steeper means it is shifting upward, plus EDV is less here and end systolic volume is also less here. So this curve is typical of restrictive cardiomyopathy. So I have given this diagram at the end. Hypertrophic cardiomyopathy, this is restrictive cardiomyopathy, and this is dilated cardiomyopathy. Am I clear? Okay, so this thing you have to remember. So this is all for today. Okay, if you have any question, you can just download the Unacademy learner app, and from there you can message me from my profile, because I am taking there on a class on a regular basis. Okay, and you can also join the plus courses there. You can attend all the top faculty lecture free there. During registration you can also use my code, referral code, that is DRSOUMEN 10, right? So this is all for today. Thank you very much for listening. Good night, take care, bye bye.